Bronchiectasis, signs, symptoms, and complications. Bronchiectasis is persistent and irreversible dilatation and distortion of medium-sized bronchi by more than 2 mm. It may be due to bronchial distension, occurring as a result of chronic obstruction and recurrent infection. Types of bronchiectasis include cylindrical bronchiectasis, saccular or cystic bronchiectasis, and varicose bronchiectasis. Symptoms of bronchiectasis include persistent productive cough with ongoing thick and purulent sputum production, hemoptysis due to bleeding from friable, inflamed airway mucosa, and massive hemoptysis, often due to bleeding from hypertrophied bronchial artery, dyspnea, and wheezing reflect, widespread parenchymal destruction, or COPD. Systemic symptoms include fatigue, weight loss, and myalgias. Patients are either asymptomatic or have a non-productive cough associated with dry bronchiectasis of the upper lobe. This is called bronchiectasis sicca. In case of acute exacerbation, the following may occur. Amount of sputum increases. Sputum becomes more purulent and often more bloody. Systemic symptoms like fever may be more prominent. Signs of bronchiectasis. A general examination of the patient may reveal clubbing and cyanosis. Auscultation of the chest reveals a combination of crackles, rhonchi, and wheeze. These findings reflect damaged airways containing secretion. The classical diagnostic finding is the presence of coarse leathery rales, especially at the base of the lungs posteriorly. Wheezing may be present due to associated asthma or bronchospasm. In case of advanced disease, with chronic hypoxemia, the patients may develop cor pulmonale and right heart failure. Symptoms associated with right heart failure include shortness of breath or lightheadedness during activity, fatigue, fainting spells during activity, chest pain, and swelling of the feet or ankles. Upper lobe bronchiectasis. This involves posterior and apical segments of the upper lobe. It is common in tuberculosis, cystic fibrosis, and allergic bronchopulmonary aspergillosis. Dry bronchiectasis, or bronchiectasis sicca. Only hemoptysis is present. There is no sputum production, usually seen in upper lobe involvement in tuberculosis. Middle lobe bronchiectasis, also known as Brock syndrome. This is a term applied to recurrent atelectasis of the right middle lobe in the absence of endobronchial obstruction. After several episodes of atelectasis, bronchiectasis, and chronic fibrosis of the right middle lobe may develop. It is usually sequelae to primary pulmonary tuberculosis, resulting from obstruction of middle lobe bronchus by TB lymph nodes, pseudo or reversible bronchiectasis. It is a temporary bronchial dilatation occurring in an area of lung affected by pneumonic consolidation, tracheobronchitis, or lung collapse. Complications of bronchiectasis include hemoptysis, metastatic abscess involving the brain, pericardium, etc., pneumothorax, cor pulmonale and right ventricular failure, amyloidosis, recurrent pneumonia at the same site, pneumothorax, and lung abscess. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.